Hi everyone, welcome to the class of Pediatrics. This is Kids Covery and myself Dr. Par Luthra. The topic of discussion for today's class belongs to pediatric nephrology and the topic is cryptorchidism. So cryptorchidism is something I hope you have read in your basic anatomy. Crypt means hidden, orchid is testis. So hidden testis is something which is called as cryptorchidism. So please understand what is cryptorchidism is the lack of one or both the testes within the scrotum by 4 months of age. So we just wait, even if generally the testis will be found in the scrotal sac itself, but we still wait for your 4 months of age, and since it is not available in 4 months of age also, then we label it as cryptorchidism. Okay, so why it is going to be there? Either there is testicular agenesis or there is testicular atrophy, that means it has not been formed properly, or because of the lack of the testicular decision, okay, which is there. So what is the epidemiology? Please understand that it is the most common congenital abnormality of the genitourinary tract. It is the most common, indeed most common abnormality of the genitourinary tract. And the risk factors, see, of course, prematurity or the low birth weight, both of these are actually the risk factors associated with cryptorchidism. Now, why is it so? Please understand, like for example, the child is not mature. It takes 9 months for the descent, okay, for the descent. So descent of testis completes by 9 months, okay. So it takes 9 months. But if the child is prematurely born, okay, if the child is prematurely born, what is going to happen? Of course, the descent is not complete and the child is going to have cryptorchidism. Now, clinical diagnosis is of course made on the basis of a physical examination, and if you are unable to palpate the testis, it's actually the pathognomic finding which is seen. So then there are 2-3 things which you have to understand. See, either it can be abdominal or it can be inguinal. So if it is abdominal, of course it's not being palpated. If it's inguinal, it can be pushed to scrotum but retracts immediately to the pubic tubercle. So if it's inguinal, you put the pressure on inguinum, then it is going to go into the scrotum, and then once you push, you pull your hand away, the testis is going to get back into the near the pubic tuber. Now, it can be ectopic also. So if it is located in the superficial inguinal pouch, okay, superficial inguinal pouch, we call it as ectopic, okay. Or you can say that the most common site for ectopic is nothing but superficial inguinal pouch. Now, what is the natural history? See, testis is significantly less likely to descend after the 4 months. Yes, I have told you all this. Now, what is the treatment? So, what you have to do, the treatment of choice is orchidopexy. Now, what is orchidopexy? So, orchidopexy means that you have to bring the testicles down and then you have to perform a suture or something so that the testes are repositioned into the scrotum and these are stitched. Can you see? Reposition testis into the scrotum and stitch it into the position, normal position. And this is performed between 4 to 12 months of age. Generally, it is believed that after 12 months of age, the child is going to have consciousness, the child is going to retain the memory, and the child should not have a memory like this. So it's a tradition that we performed it before 1 year of age. Now, why do we perform this? Why we are not happy even if the testis is in the abdomen or the mid-inguinal? That in order to produce the spermatozoa, it's required that the testicles should be in a cooler environment than the body environment, body temperature. That's why it is our moral duty. It's a compulsion for us to have the habit in the scrotal sac, number 1. And of course, in order to reduce the risk of testicular cancer and infertility. Infertility I have discussed. See, testicular cancer can even happen if they are in the abdominal cavity, okay. So if it is not treated, it can cause infertility, can cause testicular cancer, it can even cause testicular torsion, which I hope the surgery faculty will teach you or would have taught you in great detail. So even after treatment, what happens? Like even after orchidopexy, the risk of infertility and cancer remains very high than the patients who don't have this disease. So cryptorchidism is an issue, okay, that has to be looked after very well. So please never miss out on the physical examination, my dear friends. It's very, very important. चलिए इसी के साथ में I'll take your leave. Thank you so much.